I'm Andrea Klein-Thomas, reporter with CBS New York here at the 5th International Vatican Conference. I'm so happy to be joined by Dr. Steve Trzeciak right now. Thanks for being here with us.
Thank you so much, Andrea.
Yeah, a lot of medical conferences don't really deal with the whole person, right? The whole patient. Why is this conference so unique and so critical, especially during these times?
Many medical conferences occur in the bubble of a specific field, but the Vatican Conference is incredible in that it is multidisciplinary, bringing together a fascinating mix of people, not just scientists, but also business leaders, entertainers, athletes, philanthropists, and religious luminaries from multiple denominations to have real conversations about ways to improve human health in meaningful ways. And this collaboration brings exciting new partnerships and advances the public awareness about the latest approaches to promote good health and cure disease.
Yeah, let's talk about compassion right now. Often considered a soft skill, right? Like it's nice to have. Why is it so important in patient care? And how can it be put in the forefront where it's not just a nice thing to have, it's crucial to treating patients?
Andrea, you've hit on an essential question, which is, does compassion really matter? Well, through the lens of science, my colleague Anthony Mazzarelli and I, in our research for our book, Compassionomics, we curated all the data from 1,000 scientific abstracts and 280 original science research papers. The answer to this question is a resounding yes. There is a very clear signal that compassion matters for patients, for patient care, and for those who care for patients. Compassion matters not just in meaningful ways, but also in measurable ways. There are 24 different mechanisms of action by which compassion can have meaningful beneficial effects for patients. And those benefits are physiological, psychological. Compassion gives higher quality healthcare, and it promotes patient self-care. So for example, if you're a physician or any healthcare provider and you care deeply about patients and they know that, they're more likely to take their medicine. But some of the most striking effects are on healthcare workers. And we know this has been an especially hard year for healthcare workers around the globe. The research shows that compassion increases resilience and resistance to burnout. And taken together, there are no adverse effects of compassion that we know of, no side effects. The evidence points to compassion being able to be a wonder drug of sorts for the 21st century.
With such overwhelming evidence, what now needs to be done to put it into practice more widely?
And essentially, it's how can we keep compassion on the forefront of medicine and human connection in general? I think there are three ways, and they're all related to mindset. How do we have a compassionate mindset? Well, the first is what you've already hit on, is that compassion is evidence-based medicine. There's as much evidence for using compassion in healthcare as any pill you took this morning or any surgical procedure that you're planning to have. There's science in the art of medicine, and the science is strong. The second part of the mindset is realizing that compassion doesn't actually take much time at all. Research shows that compassionate connections only take 40 seconds. And a third part of the mindset is realizing that change is possible. I used to think that we're either wired for compassion or we're not, but the scientific evidence shows that compassionate behaviors can, in fact, be learned. And that's good news indeed. For somebody like myself, I consider myself to be a work in progress, and I'm working hard to get better at compassion every day.
And it has such great outcomes, and it does not cost anything.
That's right.
So that's fantastic. Dr. Trzeciak, thank you so much for being here.
Thank you so much, Andrea.